Good afternoon. My name's Rob Enns. I'm from Vancouver, University of British Columbia, St. Paul's Hospital, and I'm joined today by Dr. Overholt, who we're just thrilled to have join us from Knoxville, Tennessee. And his most recent article in Gastrointestinal Endoscopy, the Free Colon Cancer Screening Day, a Template for Success. And I think this is just an absolutely fantastic idea. And Gina, why don't you just tell us a little bit about the background as to how a free colon cancer screening day came about?
Our group has been quite successful in our community, and the staff, recognizing the success, decided and recommended that we do something to benefit our community, and that's how it started. And with that, we decided that what we could do was use our skills in screening colonoscopy. So we devised and implemented a plan for a screening colonoscopy day.
And how many years have you been doing a screening colonoscopy day?
We've done 3. We're doing our 4th one in October of this year. And beyond that, I will try and develop a community-wide screening colonoscopy involving all gastroenterologists.
And so, how do you pick the group? I assume these tend to be underprivileged groups that don't have easy access to endoscopic procedures. How do you pick a group to screen? What type of process do you go through?
We did not have the resources inside our own group to do that, so we turned to the 2 free medical clinics in Knoxville, and they screen patients to be sure that economically they're the underprivileged, and they don't have insurance and they can't afford to have screening colonoscopy. They did the screening for us. We gave them specific criteria about symptoms. They're not allowed. These are true screening patients above age 50.
Fantastic. And your staff, you beat them over a stick to be involved, told them that their employment depended on their involvement in this volunteer day, or how did that work?
They drove that equation. They wanted to do something good, and so we offered the opportunity on a certain day each year, and the staff would sign up for it, and we've had more than adequate staff each day that we've ever done it. It's quite remarkable, and the staff gets so excited, and the motivation is high, and the esprit de corps is very high.
And now, so you pick a day for colonoscopy screening, and are you looking at weekday, weekend, or how did you decide what day of the week to pick?
We chose a Saturday because clinics ordinarily are not open on Saturday. We chose a Saturday in which there was not a University of Tennessee football game, a significant competing event. And so we decided on a Saturday in the fall on a non-football day.
Oh, I can see that. I can see where that you picked the right day, and then you find a group of patients that are being sent to you for this. What about, do the physicians worry at all, or the nurses worry about liability? Hospital concerned about liability since you're connected with the hospital as well?
We're all concerned about liability, whatever we do, and we were with this event too, but we went to our malpractice carrier and cleared that. They said there was no increase or no risk, and to go ahead and carry forth just as we would ordinarily.
But you obviously advise anybody that wants to set up something like this to make sure that their liability is up to par with what they need to do.
Yes, because you see the patient that one day,
Yeah.
and you do the procedure, and then you turn them back over to their medical clinic,
Right.
and you don't do any follow-up except notifying people about polyps.
Right, right. So it's different than your usual standard of care.
We do not schedule a follow-up surveillance colonoscopy in these people.
And can you tell us about how many patients you screened and what kind of yield you found, what you found in these patients, and also a little bit about their, what the patients thought. I assume that the patients were probably quite grateful about some of their satisfaction issues.
The patients were absolutely thrilled to be able to have the procedure. They know the importance. It's very interesting. They all knew the importance of screening colonoscopy, but they couldn't afford it. And to have that opportunity was most impressive upon them. We we tried to screen 50 patients each Saturday that we did this. So over 3 years, we've scheduled 150. 144 have shown up and had the procedure. And of those, 61% had colon polyps, of which 2/3 turned out to be adenomatous.
Wow. Wow, that's
That's about 40%. That's higher than you would ordinarily expect, but these were people who had not had colonoscopy. So they were, if you will, a fresh colon.
That's fantastic. So what advice, I mean, obviously it brings an incredible amount of goodwill to the community, as well as I think endears people towards procedures like colonoscopy, hopefully teaching them that it's not as bad as they might have heard. What advice would you give to people that are looking at setting things up like this in the future?
Well, you need to give yourself at least 6 to 9 months to plan. You need to involve business. You need to involve your local chapter of the American Cancer Society, but most importantly, you need anesthesia, you need your physicians, you need your staff, you need your pathologist, and you need the approval of the hospital in case a complication or surgery is needed. They need to approve that they're going to provide the care without charge.
That's absolutely fantastic. I think this is just a real template for success for anybody in any community to look at doing something like this. I think that you also develop a real team approach with your group, which you've obviously long since developed with your endoscopy group, and I think that hopefully others will also take Gene's lead in this and follow suit. So I do want to thank you for joining us today, and I want to congratulate you on an outstanding effort, and hopefully it will continue and others will pick it up as well.
Thank you very much.